NHS 111. If your call is about physical health, press 1. If you are in mental health crisis, press 2. If you are This service is for mental health crisis only. If you're calling about physical symptoms or your medication, please press 1 or press 2 for mental health crisis service.
The 2 times that I did call crisis services was when I was really quite poorly and very distressed about the situation that I was finding myself in. I had lost my house and my job, and I was really quite poorly. I actually wanted to end my life.
Initial response service, Ellie speaking. Can I help? Right, I've just got to go through a few questions with you, Miss Smith. So can I just ask what's going on today?
I actually put off for a long time ringing. I knew I was struggling, and if I didn't get any help at that point in time, to me it was either make the call or go on to do something where possibly I wouldn't be here today.
If someone was in a mental health crisis, we would like them to contact 111, press option 2, and they will come through to one of our call handlers within the initial response service, who will support either with them a referral to the local crisis team or signpost them to the most appropriate service.
Initially I was terrified because I was very upset, but when I did get through to the person, they were really quite helpful, and they spoke in a very sympathetic and kind way.
Our call handlers receive a lot of training to support any member of the public, ensure that they screen and guide them to the most appropriate service.
We always say crisis is different for every person. It's individual to the person calling. So we would obviously answer the call and take some initial details, name, date of birth, that sort of stuff, just to identify who we're speaking to, and then ask them sort of what's going on, what is the reason for the call, and how they feel that we could help them.
So I will introduce myself on the phone, then I'll take their name, date of birth and address, then kind of go through the process of what's going on today, how can I help you, what is it that you're kind of feeling you're needing today, and then go through it that way and see what the best advice or signposting I can give the person.
We've got like quite an extensive list of signposting for services within the local areas that whether it be sort of drug and alcohol, housing, just someone to talk to where you just need that little bit of a conversation.
Try to give them as much information as you possibly can, even though you are in distress. It is really difficult though, and I understand that some people will be terrified of making that telephone call. Initially they asked how I was, and they asked if I was in a safe place, and it was just making sure that I was safe to continue on with what was a little assessment and exploring what was happening to us at that point in time. Then I got a full assessment from the crisis team. They actually had to follow me up for a long period of time, the crisis team, and I got signposted to several different services. It wasn't medical stuff that I needed, it was help from the advocate, which was absolutely amazing. The staff actually did help us with medication as well, and they put me on the right medication.
We're here 24/7, so we don't want anyone to think that they're in a crisis and can't access any support. They can call anytime. There will always be someone at the end of the phone, whether you're calling for yourself, whether you're calling for somebody else.
I provide advice over the phone to people of all ages. It doesn't matter how old you are, whether you're a younger person or an older person. If depression is depression. It doesn't matter who you are, what age you are. Look for that support. This is here.
If you are in a position where you feel really desperate and sad and unhappy within yourself, potentially just a telephone call to somebody external may be the point of a turning point in your life.
I think sometimes the feeling is it's not bad enough to ring the crisis team, it's not serious enough, but we're not just the crisis team. We have, like I said, all of this information to signpost you to and to get you other support. So whatever it is, just call and we'll we'll help however we can.
Always make that call. We're never ever going to judge you, no matter what. There'll be something we can help with always.